Hello, my name is Caleb Smith with the Rocket Miner newspaper, here with an update for November 18th, 2020. It's been quite an eventful day, though some of it's fallout from Tuesday's events. That is when Sweetwater County had a mask order go into place. It resulted from our county health officer, Dr. Gene Station, requesting one from the state government. The request was reviewed by the Department of Health, and particularly State Health Officer, Dr. Alexia Harris, and was granted yesterday afternoon, in addition to quite a number of other counties had mask orders go into place, either late yesterday or this morning, such as Carbon County. Under the health order, the expectation is that people will wear masks when they're out of their homes and in places frequented by the public, such as businesses, city and county government buildings, medical care places, and some places, like I said, more that shared stuff like public transit, ride-sharing places. It stresses that the mask is to cover the nose, mouth, and the area around it, and not have any holes or be sheer or anything like that. So, no masks hanging off the ear. There are multiple exceptions, at least 10 paragraphs worth of exceptions for that. The ones that primarily come to mind would be minors, people with medical conditions, though there's some others that are delineated there. They understand that you're in a restaurant, you're probably going to be eating, and with proper distancing, it makes provisions for that. With all those qualifiers in place, it was also announced today that the Sweetwater County Attorney's Office and the Sweetwater County Sheriff will not be enforcing the mandate. I would point you to some of the stories on our website where you can actually see in their own words where they explain their rationale. While this is just one put in place by the county health officer as using the power given to her by the state constitution. It remains to be seen if we'll soon see one from the governor's office, if not a national mask mandate, in addition to most likely seeing other changes in guidelines, possible restrictions. We'll report on those as they come. And like I said, I would point to you for those details, whether it's the additional explanations, exceptions, and the fallout from that, whether that continues to come from the coronavirus. Honestly, the other one that caught my attention this day was the University of Wyoming football game being canceled and will not be rescheduled because the Utah State team has too much coronavirus amongst its players. But what I'd like to focus on right now is redirect the spotlight, so to speak, on our county health workers. That might be those working in school districts, care centers, hospice, or government and hospitals. They are facing an unprecedented challenge, at least for our generation, our lifetimes. This is stuff that maybe read textbooks about, but this is something that, for all the training, all the drills you can do beforehand, this is nothing like what we've faced before. Day after day, they are working on the front lines, often getting more exposure than anybody else, working in clinics. Even working at the front desks means that many of these people are qualifying for hazard pay. And as their numbers go up, and the number of positive cases that we're seeing, so does the risk, so does the pressure, so does the weight that they bear on places that are even more sensitive than their shoulders. Our case numbers are up, our hospitalizations are up, and we've been warned to expect that our death count will increase if the trends continue as they have already. And there's a time and place to talk about tactics and strategies. But what I would just say is that for those of you who are working that job, I appreciate what you're doing. I think most of us appreciate what you're doing, and we're thankful that you're out there doing this hard work, doing this unpopular stuff. I mean, you sometimes even it's sometimes in the phrases that we use, like "take your medicine," as in the message that we know it may not be what you want, and it may not fit your taste, but it's what you need. It's not fun to be the bad guy, to be the one who who encourages stricter, more rigid behavior. I mean, no one likes to be told what to do. I don't. Most people I know don't. But yet, it takes more to get past that childish impulse than to do what's right for yourself, what's right for the community. And right now, we have some very hard-working, honestly overworked, overtaxed, undersupported people trying to do their utmost and to protect us and to do what they think is right. Put politics aside, put other identifiers, be it might be background, club affiliation, financial strats, divisions, and all that. And I think if you get at the heart at these people who are trying to take care of us and help us take care of ourselves, at the very core, they're doing what they think is best and what they believe is right. Like I said, we may disagree on the best way to go about flattening the spread and what needs to be done during a time of a pandemic. But I hope that there's no doubt that these people are doing what they honestly believe is right. There are caregivers. They are the ones who provide us comfort, safeguards, and when we inevitably get hurt, get sick, have bodies that betray us, they're the ones that are doing whatever they can to get us back to the norm so we can enjoy the quality of life that we all aspire toward. I think that these are exceptional people. I think that they, the fact that they wake up every day, shake off whatever remnants of the day before, or clouds that may face them ahead, and they still do their darndest day after day, is extraordinarily commendable. And they should hear it more often. This is a thankless duty, and they knew that going in. But it's an even more charged and antagonistic environment right now. And at a time when I know they're getting lots of negative feedback, and in some cases I'd say is unfair criticism. Most of us, if you're watching this online, you read a comment section and you know how that dialogue can get and how ugly it can be. But I hope that people stop and take time to maybe write a letter, send an email, make a quick phone call, schedule a fruit basket, just to say thanks. Hang in there. We're glad that you're watching out for us. I think at the core of everybody, we want the best for everyone, and we want people to get through this handily and as quickly as possible. They are carrying an extreme weight, and your kindness and understanding can go a long way. And I'd encourage you to offer your words. And even more than that, I'd encourage you to put some actions behind it. Follow those guidelines that they are encouraging us to do. Wear the mask correctly. Do that extra distancing. Wash your hands more frequently. Try to limit your trips out, your engagement with other people wherever you can. To the necessities. Where I'm not saying stay home in, but just cut down on those trips wherever possible. Stay home if you think you're sick, and get tested if you are having coronavirus symptoms, and or if you just come into contact with people who have tested positive too. You do that, that'll do it. That will be a great contribution to reducing the load on the individuals and the institutions that we rely on to take care of us. It's fair. We can help take care of them as they take care of us. This is Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow. Bye.